So a couple of other things is it's a standardized contract for all of your clients. So for those of you guys who have gone through the process of getting that big, large document from career staff to staff for them, for Genesis Healthcare or any of their clients, you'll see it as a long document. And if you decide to work with Genesis Healthcare, Benchmark, they have a couple of other clients in that long-term space, Genesis Rehab, AIDS Health Foundation, then you would sign that one contract. You're also accessible, and we'll look at some of this as the session started, to a larger pool of staffing needs. So like currently, their staffing needs is at 10,000, but I will say this as a caveat. Some people don't have the same access to the same client, so the needs can look a little bit different. But across the board, right now, we're seeing 10,000 openings, so that's pretty consistent. The other thing is their process for credentialing is standardized. So for those of you guys who are interested in eventually going into doing joint commission or that joint commission process, this is a great stepping stone to allow you to really be able to really centralize your credentialing process and have it consistent no matter what the client is. So for the most part, you'll submit the same types of documents, no matter the client. They'll meet 9 times out of 10 the same joint commission requirements, which makes it a lot easier as you transition. The billing process is consolidated. You get invoices sent out on a weekly basis to you about the shifts that your employees work, as well as you get the opportunity to see the shifts they work under the time card. But I'll show you guys that when we get there. How to gain access to more clients. So for those of you guys who are already with career staff, you can always reach back out to your account manager, which is what we did, and said, hey, do you guys have any new clients? Because the clients come and go. Probably this past year, Genesis sold some of their properties to Autumn Healthcare, Benchmark, Senior Living, and a couple of other places. Then you kind of have to make sure that you're reaching out. So they rarely will come to you and say, hey, we have some new clients. So you have to stay in contact with your account manager, which is essentially the person that goes out there and, solicits for businesses or send you your initial contract and ask about certain meeting requirements for your insurances and things like that. And then I kind of already touched on the fact that this could be a good stepping stone for joint commission. And then the other thing is, for some of the clients, you might have to have an invitation to staff for them. So for those clients, you would need to go through whatever that process is. And sometimes the account manager will know, but typically for the facilities that say you need to be invited to staff for them, they'll be able to tell you that process and what that looks like. A couple of things. So I'm just going to kind of touch on all of these things before we jump into the system. The starting bill rate. So the career staff system is broken into 2 vendor management systems. One vendor management system, which is career Stafferlink, which covers the West, East, Northwest, Mid-America, and East regions. And then B4 Health is the other vendor management system that Genesis Healthcare has, and that covers Maryland, Delaware, Pennsylvania, and New Jersey. When you think about the West region, it's pretty much the West Coast from New Mexico west. The Northeast region is essentially Maine down to about Connecticut. And then Mid-America is Mid-America would be Georgia, Florida, and then Mississippi, Alabama, that curve. And then the East region is Virginia, West Virginia, North Carolina, that area. So that's kind of how they break it out. And all that's included in the breakdown of the contract about what region covers what. So one of the main differences between Genesis Healthcare or Stafferlink and other vendor management systems or MSPs is that they have a bidding system. So similar to bidding like you do on eBay. So most of your other MSPs have a set rate. So they may say, hey, the rate is $75 for a med-surg nurse in Tennessee at Texas Baptist Hospital. Or, they may say our highest billable rate is this or that. So it's important to know the difference between the two. So that's one of the good things. And that's where I kind of went over to the next one where I talk about smart bidding. So the same way that you go about figuring out, oh, what's the bill rate for this direct client or this client, or you feel like the rate's too low, or maybe you find out because someone shares that information, it's the same way that you have to do with career staff. So career staff does give you a starting rate, and typically the starting rate can vary. It's definitely based on the region, and it's fairly competitive. But for you as a agency owner, you can bid up to a certain rate. So the example I give for us when we were bidding in New Mexico, when we first started out, I want to say that the bidding start rate for LPN was $36, but we were able to bid $56, and the client accepted that bid rate. So it's the same thing. I did the example about smart bidding as if you decide to have $100 bill rate and you have a pay rate, so you're paying the staff member $55, you do have to pay a fee. So all of your MSPs will have a 5% fee, or sometimes it might be 3 or 4% of what you're paying your employees. So whatever you're billing, they will take 5% of it. And then I gave the example where you have a gross profit of the $40. So for us, one of the other benefits is that you have more volume. I know a lot of people have questioned, oh, well, it takes them a long time. So it typically takes about 45 to 60 days to be paid. You don't have to worry about any sort of timekeeping because all of that's done in their Chronos system. So I'm just talking about the Genesis Healthcare client, they use Chronos across the board. And then the only other thing you would have to factor is if you have any sort of payroll funding, that piece of it is a fee that you would also have to pay off of whatever your profit is. I put here as an example some of the going pre-COVID bill rates to kind of give people an idea, and it's pretty much broken out from CNA, LPN to RN. Some of that's changed because when they did do COVID, they did offer COVID rates. So some of the positions had COVID rates, and they still have some COVID rates, but a lot of that's outlined in the contract. And I'm not getting into the details of the contract with this session. A lot of that is already clarified. So it'll say local rates, travel rates, and then it'll say COVID rates. Just because we know COVID isn't going anywhere. So they do have a rate increase for COVID. So a little bit about the credentialing process, and then I'm going to give you guys a chance to ask questions and we'll look in the system. So for the most part, all your clients are gonna want a background screen. Some of them will have the person do fingerprints when they get started, but statewide, some of them might ask federal, but minimum statewide background. Drug screening, typically a 7 or 10 panel drug screening. We've used LabCorp and Quest, and we haven't had any issues with getting a more or less 24 to 48 hour turnaround on that. Some sort of competency testing or skills checklist. And then I put there for the joint commission clients, because there are some clients that are joint commission, they typically require a competency test, whereas your non-joint commission clients you'll be able to provide them with a skills checklist, and that's sufficient. Regular testing, TB, Hep B, flu vaccine, titers, and then any sort of client specific. I know, because this presentation was pre-COVID, that they are having a COVID vaccine form similar to your flu vaccination form that they've included. They also have a form where you acknowledge that these things have done. So that's another form. And I mentioned earlier to everybody, if you don't have the forms, I can send it to you, but you might want to get the forms from your account manager, because that's where I got the forms from. So my account manager sent me a lot of the forms. So that's that. One of the things I encourage people to do prior to really getting in or seeing the benefit of working in any vendor management system is creating a proper workflow. So if maybe your process isn't as concrete or have a flow to it, where from the point that the person fills out the application or receives an offer letter, there's a process and it's not necessarily involving you, but they just kind of get pushed through the process. That's something that I would encourage you to implement. As well as if you have a team, like we had a compliance coordinator, we also have recruiters, to have those individuals operate through goals so that there's no confusion. Because prior to the person being able to actually pick up shifts or be assigned shifts, you actually have to get all of the paperwork that we showed in the last slide uploaded into the system and get them what we call activated. So in the meantime, if the drug panel is a 5 panel, but your client says they want a 7, they won't get activated. If they're missing a background investigation, they won't get activated. So one of the things that we were heavy on through trial and error was creating a streamline of the process so that there's a checklist for our staff that's managing that with the applicant so that they can move through quickly. You know, hey, if they're signing up to be a CNA with our agency, these are the things they need to complete. We've used DocuSign, HelloSign, so that it made it seamless as possible. You know, easy systems, like I mentioned here, like Kamana, where they could easily upload, you know, TV, JPEGs or pictures of TV, CPR cards, so that it's not a constant back and forth. You can use whatever tracking system that you currently use. You just want to make sure that it has the features that allows it to make it easier for applicants to upload documents. And communication. So the main difference with Stafferlink versus a direct client is that you're not actually communicating with the facility. That's not something that they'll allow. You'll be communicating with a compliance person in the system. So if you submit a document, for instance, I gave the example of the 5-panel drug screen, and it's not correct, you'll receive a message in the system that'll say, you know, needs a 7-panel, uploaded a 5-panel. So you want to make sure that the people that are managing that piece for you are very computer savvy and can understand, hey, you know, how to turn documents, how to change a word to a PDF or a JPEG, so that process is a lot easier for you as well and time consuming. So here I gave the example for our recruiters, from the time that the person accepted the offer until they were active in the system, our recruiters' goals were 5 days. And of course, the sooner the better, because sometimes you do have to do a little back and forth with Stafferlink on that. So, and a lot of that is dependent upon the applicant, because we're just waiting for them to give us the information. So I tell people in that initial contact, kind of be clear and transparent with your applicants about what is needed to get them activated. And some of that may vary from client to client. I tell people, especially people that are looking to expand, this is a great opportunity using a vendor management system to increase your volume. You are able to easily increase your billing hours. We did our first 3 months in the system 300 hours, 3 months out. And we were able to do it regularly. Going into our year into the system, we kind of changed our model, and some of that's a mix between contracts and per diem. But we decided that because we're a small agency and per diem can be very time consuming, and that wasn't our niche, we decided to kind of make part of what we did was converting all of our PM staff into a local or travel contract. And like I mentioned there, it allows for more consistent monies and long-term opportunities. One of the people that we did it with, she started in an 8-week contract that extended for a whole year. And we were not involved with managing her schedule. We definitely checked in on her, made sure that she had the things that she needs, updates and things like that. But she was happy, client was happy that 8-week contract turned into a year contract. And then it also allows you to diversify your portfolio. So in the way that for many of us, you want to get that next client, it's always great to say, you work with these clients too. So if you're a part of a vendor management system, you work with Genesis Healthcare, you work with Benchmark Senior Living, you work with Recover Care and Autumn Healthcare, because they're all clients in the system. So that's a selling point for newer clients, if they're direct clients or other vendor management systems or MSPs that you might want to be a part of. And the last part I think we got here is budgeting, planning. I touched a little bit on the fee. So there is a fee. Every MSP has a fee. How they pay it out might look different. So some you pay a flat fee. Career staff is a 5% fee. And because it's a 5% fee, if you're also paying payroll funding fees, you want to make appropriate adjustments to your bill rate to account for those fees. So like if say your payroll funding fee was like 2%. So that's like 7% of your profit. So you may want to up your particular bill rate a little bit more and or increase your volume. So this was some of the frequently asked questions that I'll touch on, and then we'll jump into the system. I'll give you guys a chance to ask questions. So how many job openings, per diem, contract, permanent are available? We'll look at that. It's always over 500 jobs. How do you gain access to to career staff specifically? Initially, you'll need to reach out to the account manager that'll give you the specific insurance requirements. So each client, example, Genesis Healthcare, has a insurance requirement. Sometimes it's the same. So for Genesis Healthcare, it's 1 and 3, but for some other clients, it might be 2 and 4. And this is specifically talking about your general and professional liability. Do you have to be Joint Commission certified? For career staff, no, but for many clients, many other systems you do. Or if you don't, if the client isn't, they'll limit your access. So if you get with MetaFest, you can get in there if they're accepting new vendors, but you may not be able to see all of the opportunities that they have open. Where do you get training? So your account manager. So I encourage you guys, especially those of you guys who are interested in getting in the system, really use and communicate with your account manager. They should be sending you information about getting started and kind of be able to keep you in the loop and answer any of your questions. And once you do get started, they will provide you with like a little packet or a little informational email to have contacts of the different clients moving forward. But you definitely want to use your account manager during the initial process. They also hold bi-weekly training. I want to say this Thursday, and I'll reply this Thursday if it's the case. They're having a training session. So it's a Zoom session similar to this, but it's a little bit more specific. And you can take it as many times as you want to. What are the payment terms? Payments are typically made 45 to 60 days after the hours have been invoiced. So your hours are invoiced weekly. So from that date, it's usually 45 to 60 days. And then the last one is, do I need to be registered in other states other than my home state for staffing through VMS? So yeah, so if you're doing business in another state, you need to register as a foreign entity in that state or whatever their state requirements are, and make sure that you have proper insurance coverage for your employees there. Another thing I want to note is that all employees within most MSPs, VMS systems have to be W-2s. So just so you know, okay. All right, so let's look at this really quickly and then we'll go into the system. So when I was talking about adding the registrant or adding the applicant or employee to the system, this is what I was referring to. So this is kind of a PDF. I can forward it to you guys about the process. And they also go over this in the actual training class, which I'm very, very sure it's on Thursday. And then here where you guys see, you may or may not see it, where it says do not return. So when you put applicants into the system, the initial part here, before you're allowed to add any of their documents, the system does a check and it'll kind of say, okay, this is a prospect applicant, or it'll say, do not return. Where you see the highlighted red means that that employee, for whatever reason, typically you're not able to find out, the employee should know, cannot work for a Genesis Healthcare facility. It doesn't mean that they can't work for other clients in Stafferlink, but they cannot. We've attempted it once there, do not return. It's between the employee and the facility to rectify that, but there's really nothing as an agency you can do to unring that bell. This just touches on adding credentials, and this is your TV, CPR, resume, some of the things they ask for here. And then this is kind of what it looks like, a little bit of a snapshot of what it looks like as far as once the credentials are added or attached to that person's profile. Okay, and then they're just giving more examples. And then some of the stuff applies to some clients and it doesn't, but you'll know once you get in the system what applies and what doesn't. So let's go into the system. While I'm going into the system, do you guys have any questions? Any questions?
I don't have any right now.
Okay.
But this part is going to be very helpful.
Okay, give me 1 second. I thought it picked up my.
Hi, Shamika. So would it be better for us to do a 10 panel since different clients require possibly like a 5, 7, or 10, or would they be very particular on saying, no, I don't want a 10, I want a 7?
In my experience, I've seen mostly 7, but when you get the contract from career staff, it'll show. So 90% of the clients is at minimum a 7, and then some are 10. Right. So this is for career staff, it's a 7, Letitia. But we also have had clients where it is a 10. So when Kindred Healthcare was a part of the system, which they aren't anymore, it was a 10 panel. So Genesis Rehab or Genesis Healthcare was 7, and then Kindred Healthcare was 10. So probably so. I think it would be worthwhile, but just kind of think about, are you going to staff for those clients? So when Kindred was there, hold on one second. When Kendra was there, we didn't really staff because they only had opportunities in the Midwest. So we didn't invest in actually getting a 7 panel. I mean, a 10 panel. Okay, so let me get my stuff to. One second. Hey, and for you guys who just joined, this was a event that was already scheduled. So the people who are already on it are the people who are on it. So I can't really keep letting people in because a lot of people are trying to jump on, but it was already scheduled. So, you know, so for these events, if you see it on the business page, that's something that that's been scheduled. So because I'm running so low, it's not something that's really easy for me to let people in at the last minute. All right, so let's go to, okay, we'll go to B4 Health and then I'll have to come back to Stafferlink. Bear with me. All right, I think we got it. So this is B4 Health. I mentioned that they also have different clients, but they do career staff or Genesis Healthcare. Okay. So let's start at the home. So this is how B4 Health looks, and it's very different than career staff. So a couple of years ago, all the regions were housed in career staff or Stafferlink, or all the regions were housed in Stafferlink. Maybe 2019, I want to say 2018, they broke it out. So the only Genesis Healthcare region that is in B4 Health is the Genesis Staffing Services, which is Maryland, Delaware, Northern New Jersey, and then Northern Pennsylvania. So they were supposed to convert all of the roles onto B4 Health, but they didn't. So it's split out. So if you have career Stafferlink access, you should also have B4 Health access. So this is broken out into a couple of different things. You have an inbox here where it lists all the needs, and then all the needs that you get also get sent to you as an email, and it's whatever email that you set up. So most of the needs you'll see here are in Baltimore, and I just know it because I've been in the system before. So like Saratoga Manor, those are contracts. Most of those are in Baltimore. If the contract gets canceled or gets filled, you know, this is kind of where you see all of that. And then on to the left is actually your account reps who manage that particular contract. So if you have questions or anything, those are the people that you would need to connect with. So most of these are contracts. Yeah, Crescent View, Piscataway. These are all contracts. So let's take a quick look at one. And because we don't staff heavily in Genesis Staffing Services areas, I don't spend a lot of time here, but just so that you guys can get an idea. So in Maryland, they call geriatric nurses assistants GNAs, and those CNA types who take the additional training also get additional monies. Yeah, so this is, Letitia, this is for Career Side. I'll be sending to our email. So yeah, I can send everybody an email of some of the stuff that I share. Yes. So this lists the healthcare systems, which is just Genesis Healthcare, but if you have others, it'll go here. You can search. Let's see, because it's only, let's see what's in Delaware. So you can search, it's only one healthcare system, but say if I wanted to see Brocken Center or some of the other centers, I can search that one. I'm going to search all of them because there's not a lot of centers in Delaware. So we're searching for contracts. So we see they have a CNA contract in Milford for June 3rd through 9/22. Seems about 10, 13 weeks. This kind of gives you more information. There's the hours, the date range for the contract, so it's 16 weeks. You would put in the hourly rate, the types of role, career staff, and then the facility, which is Milford, which is in Delaware. If you're not sure where a place is located, you can always go there. And then here it lists out the requirements for that particular client. So every client's going to have a reference request. They're also going to ask for an attestation form. Some require dementia training, some don't. The influence of vaccination is, dependent upon where we are in the year. When they say professional license, it also applies to certifications for your certified nursing assistants, and then your resume, and then any state specific requirements. And some of this can get a little tricky if you're doing multiple states, just because different states have different requirements when it comes to the background. For instance, New Mexico, you can run the background, but they still have to get fingerprints when they start. In Delaware, you can't run the background, you can't do the fingerprints, all of it has to go through the state. So, those are things that you just have to be mindful of from a time standpoint of view, as well as if you're bringing travelers, because people who work in Delaware, people who work in New Mexico know about that requirement. I'm talking about employees. But if you're bringing a traveler to Delaware, they may not know that you have to go into the fingerprint department to get fingerprinted. Everything goes through a separate system. And it's not something that's ever outsourced. So got documents, reports. I'm gonna keep moving. So you can run what they call a missing credential expiration report. So at any point, if your applicant's license or CPR or TB is expiring, you can run that report and it'll show you that. So I would definitely encourage people to use that. Like I said, a lot of this stuff I don't really use because it's not applicable for us. But for those who want to get it or who have access, make sure that you have both system accesses. Shifts. And then if you just want to look at one facility, their openings, you can go to that. And then it'll drop down if they have stuff open. So there's a couple of different ways for you to look through the system. These are all per diems. If you see where it says shift date, it just says today. So that's just a per diem shift. If it's a contract, it'll say 6/3 to 6/30. All of them have shift IDs. You go to request submission, and then you go to request a shift. And from there, that's where you would actually add people. There would be people here under professionals where they said select healthcare professionals. So you would have already uploaded their documents, and then they would drop in here if they're the right, if they fall in the right criteria. Okay. So home, there's not much else. Inbox stays full. You get these same messages in an email form. So I tell people, set up another inbox so that you're able to have these messages. So like, this is what? It's 92. So they sent 92 emails out into my email inbox. So you can have it directed to an actual folder. Or, just, adjust the settings so you can get it on a weekly basis or some other types of setting. But okay, so let's get to the next one, which is the one I've spent most of the time in, and most people have spent most of their time in, which is careers, which is Stafferlink. Let's just do the screen share. Okay, that's not right. Sorry about that. And your account manager is really a great resource. So as you're kind of going through the process of bringing people in, you want to make sure that you're in contact. Like if you have questions about stuff, the role of the account manager in the call center is to assist you with that. So you want to make sure that you're reaching out to them. So when we first got going, I called the call center every day. And either it was about me wanting to know the status of an applicant or what have you. And essentially that's what they're there for. They're there to answer questions, give you status updates and things of that nature. So I encourage people not to kind of be shy. That's what you're paying your extra 5% or what have you fee. For the system so that they can support you. Let's try this again. If you guys have any questions about B4 Health, feel free when I get into the.
I think I had a question about career staff. How long does it take for them to approve an applicant usually?
It can depend. For us, it's usually about 3 to 5 days if your whole profile is complete. So if you have everything that you need and there's no missing error, and over time you'll kind of create a system. For instance, like they want the referrals done a certain way. So we just created the form so that as a recruiters or compliance coordinator got the information, that wouldn't be our hiccup. So that's why I was talking earlier about kind of creating systems and processes for yourself so that something like, oh, well, you forgot to put the date when the employee worked with that supervisor won't be a stop for you to get somebody started. And I will say too, they'll work with you because they want people working because they make money. If we make money, it's all a part of the game. So they could easily say, if that's the only hiccup and you're like, yeah, I have somebody who can start today, they'll be like, okay, well, get it to us today. We'll go ahead and submit it to the client. And that typically isn't a hindrance, but you really have to communicate with them and they'll, kind of move your people through the process.
Okay. And when we're submitting a client, we have to submit them to a job. I mean, not client. When we're submitting an applicant or one of our employees, we have to submit them with a job. So we're
Right.
submitting them to a job. Oh, okay.
Right. So here, this is Stafferlink. And this is the way it looks. And if you look here, this is one of 10,000 jobs. So you would have to look and see, and I'm just gonna sort so you guys can kind of see some of it. As I mentioned, I'm not sure that everybody, so the one of 10,000 is if you have all of their clients. There are some clients that they changed around. So Genesis was bought out by a couple of different companies, Autumn Healthcare, Recover Care, Complete Care. So there, for instance, if Complete Care was in PA and they already had existing properties and then bought some of the Genesis properties, because they're a client of Career Staff, you also get access to some of those other clients or some of those other facilities or properties. So that's partially why the number is a little bit higher. This is the highest I've ever seen it. But they've added Complete Care, Recover Care, Autumn Healthcare, Fusion Healthcare Services, and all of those companies have bought some of the Genesis properties out there. So essentially, it's going to always look like this. You're going to see all this keep highlighting, which is just really telling you the job is open, closed. Let's see. Okay.
I had a quick question. When you're submitting, when you're, I guess, advertising the job to a potential employee, do you identify one facility, or you say we have plenty of jobs available? Because I just want to because if we submit them, they're not accepted, we just have another option for them. So how do you frame it for the employee?
I would, I would say if that's the case. So I would say that you have a couple of options if you have a couple of options. So, wow, this is crazy. Okay. So there are certain states that are a little bit more busy than others. I'm gonna use the states I know.
I'm particularly talking about Maryland.
Okay, Maryland's busy because they were bought. They added Autumn Healthcare. So let's look at that. Perfect. Okay, so New Mexico, they have 1,000 jobs. I would definitely say that. Maryland too, because now that they added Autumn Health and Complete Care, they have quite a few. So they have 2,900 openings. So I would say that, you know, and a lot of them are contracts. So if you look here under dates, just like in Before Health, these are all contracts. And I'll talk at the end what the colors mean. But these are all contracts out there. So I feel like Bellinger Creek, that's a new facility I hadn't heard of before. But Severna Park, Catonsville, those all look from previous that were. And if you look here to the left, it says previously Corsica Hills. So that's saying that was a Genesis property bought out by Complete Care. So yeah, so in posting the jobs, unless it's just specific, you want to kind of be generic, but be honest in that it's long-term care. And I'll show you guys another example. If in the notes here, where we see notes, they say high ratios or a bonus, you want to include that in your language too. You know, if it's specific hours, like a lot of the jobs in New Mexico, because they're CNAs and nurses do 12-hour shifts, you'll see something like, I saw it earlier, let me see. Like here in the notes under this one, it says Sunday 6 a.m. to 2, Thursday 6 to 6, Friday 6 to 6. So that's the shift. Whereas there are other clients that might say it's a variable shift. You know, they're just offering, 40 hours a week. And then in New Mexico, they have, I think everybody, I'm not going to just say New Mexico, a lot of people have a lot of these quick start bonuses. That's something that you can incentivize your people to complete their paperwork. New Mexico has quite a need, so that would explain that. And you don't also, this is a good one, I didn't mean to tap on that, but you don't just have to do nurses. A lot of places do RN supervisors. This is an RN unit manager role. They also do MDS. They do certified nurse educators, CNAs. What else? You guys help me out that are in the system. I'm some of this. So there's a lot of different kinds of roles out there. I think it's called RN super. Okay, not right. And as far as maneuvering through the system, this is what you see me doing. Okay, it's called something else. It's like an Excel spreadsheet. So you can sort each column. So you can sort each column. You can sort ascending, descending. You can type in if it's a greater than, or you can type in contains. So there's a lot of manipulation because I'm not, and I'm sure you guys can agree, I'm not looking at 10,000 jobs every day. That's too much. So you can really just bring it down to the view that you want to see. So you mentioned Maryland, let's hang out in Maryland a little bit. So that way you're not looking at thousands and thousands of jobs. So Maryland has quite a few, but what you can do as well here is edit your view and only look at contracts. So now we're only seeing, the contracts that they have open. Now I will say, I did notice since they added complete care only for Maryland, they don't have the pay, the starting pay. So that's probably something that you would have to get from the contract. So every client will list in their contract their starting pay or their desired pay. In there. So I want to get, so you can see some of the other pay. So complete care, I think it's Maryland. I think it's Delaware and Pennsylvania. So where is their complete care contracts in New Jersey and Pennsylvania actually show a starting pay rate? So this is some of the New Jersey. Again, GNAs are specific to Maryland. This is some of the Pennsylvanias. And then if they're pretty desperate, they'll, and I've looked this up for you guys ahead of time. They'll do what I've seen PA do is, I'm gonna find that one. Is offer pretty desirable roles. So like this particular job opens up several times. I'm not sure if it's specific to the facility, but this is the first time I've seen a job where they're offering $1,000 bonus for a weekend position. So essentially this person is just working the weekends. Is this the weekend one? Well, it's another one that's the weekend one. And they're, as a nurse, healthcare professional, you kind of have to be mindful. Like this job isn't terrible. When they put here 85 max rate, that means the maximum bill rate that they'll accept. So they really want to bring somebody in, but you have to think about if they're offering $1,000, offering a max bill rate, maybe there's something going on in the facility. I'm definitely not telling you not to fill it, but put your strong employees that are going to go do what they need to do, types of people at that type of facility. So now they're using notes a little bit more than they used to. Okay, so this is the one I was talking about, the weekend. So this is a weekend role. And if I was a agency owner, staffing in PA, I would put a bill rate of $85. and let them tell you the bill rate is too high. You know, they can kind of come back to you with feedback. But since they have another role in the same area, I would do that one as well at the same rate. So up here where you see the locked offers out is essentially what it says. It's just saying that another agency, because a lot of agencies have access to the system, it's really just saying another agency has put a, you know, submitted a person and they have an offer out to that person. So they're just waiting for that person to confirm it. And 9 times out of 10, it'll get confirmed. If it doesn't, they'll cancel this job and reopen it. Couple other things to, we'll look at a couple of other states and then I'll talk to you guys about the top bar: orders, registry, time cards, invoicing. Anybody have a state they want to take a look at?
Georgia.
No, there's nothing in Georgia. I'm sorry. We could get closer. That's Shanika. There is something in Alabama, Shanika.
Illinois.
Okay, I could do Illinois. So this is what they got open in Alabama, which is quite a bit. Alabama and Georgia. I think the one Georgia facility they had, they sold it. So the red means it's canceled, just so you guys know what you're looking at. So this means the job is canceled. And then this orange means the job has been filled. So it just means another agency filled it. So they don't share the agencies that fill the jobs. So they have quite a bit in Alabama. You say Illinois. I don't think Illinois is on here either. I don't think Genesis. So we're just really looking at Genesis. So no
Can we look at
Illinois.
Ohio?
Don't think Ohio's on here either. Ohio used to be on here. I
Yeah,
think they sold their properties as well.
yeah, most of them are all we're all bought out.
Who
But I
do you
know
know the
they're not gonna-
company? Do you know the
Yeah,
company?
what is it? Let me see.
Okay.
I'll get back to you.
Sounds good. So this is Kentucky. Kentucky is also a busy state. And Kentucky is very particular. So if you look here in the notes, some of the differences is Kentucky has a lot of attendance. If you call out twice, you're canceled. You know, they have a lot more requirements. They do have orientation, which is good. Not every place will give an orientation. And this is a little bit different than New Mexico because it says it's based on facility needs, whereas New Mexico had a set schedule. What else? Another good state for you guys to think about is well, I guess not. I think they sold those properties, is Massachusetts. So Massachusetts has quite a bit of need. New Hampshire. And I'm trying to think about it off the top. Arizona has a bit going on down there. They used to be in Texas. I know they're not in Texas anymore. Sometimes things will pop up in California. They do have a client in California, but it's always a hit or miss. So like some of your smaller states, or not smaller, some of the states where they don't have as many facilities, things will look different. But some of your popular states, Colorado, so on the East Coast, definitely Maryland, Massachusetts, because right now we're just looking at contracts. Maryland, Massachusetts, New Hampshire, Vermont, PA, New Jersey, and then
skilled.
it was, say it again.
Skilled, SKLD.
Okay, so maybe they're, yeah, you can maybe see who's handling them. I'm not sure. Vermont, New Hampshire in the Northeast, West Virginia is very popular. Alabama, I see is more popular. They used to have some properties in Florida. I think those probably got sold. I don't see those come up anymore. Kentucky, but you know, Maryland, I think I said Maryland, West Virginia, Kentucky, then the middle, like that middle America. So like Montana. So you guys can see. And then I'm gonna, oh, no more Montana. Oh, maybe that's the wrong thing. Iowa. I think it's Iowa. Yes, no. Okay. North Dakota. Oh, okay. Well, okay. I might be doing something wrong, but a lot of those middle states like Colorado, Montana, North Dakota, South Dakota usually have something. Washington State, as well. And then because this is all their needs, you also see roles for speech language pathologists. If you do physical occupational therapy, you'll see some of that. Let's see, I think I have it sorted. Okay. Well, you'll just have to play with it. So you'll see some of that. In Vermont, since I'm looking at it here, they, like Maryland, don't call their certified nursing assistant roles CNAs, they call them licensed nursing assistants. So that's just something to, you know, note. I think there's some other states that have a few differences for that particular role, like they may call them medication aids and things of that nature. But for the most part, the system is user-friendly. This is an Excel spreadsheet. Here is where you kind of know what the colors mean. So if it has a little star, it's a new order or a change order. If it's been canceled, like we see here in red, it's red. If it's open, it's white. If it's pending, meaning somebody from your organization was submitted for it, it'll show up in yellow. And then unconfirmed shifts for your organization will show up in blue. And then of course, scheduled shifts will show up in your organization in green, as well as field shifts from other places. You can look up, you know, pending, there's nothing pending, canceled. So you can look at different views, scheduled, nobody's scheduled, field as well. You can also look up, if you just want to do per diem, you can see what's out there for per diem. If you wanted to see per diem, if you just wanted to see contracts. And then some people don't know, but Genesis also does permanent placement. So this is your permanent placement jobs. This is for a center executive. That's what they call their administrators. So it's showing you what they're looking for. And the actual payout rates is listed in your contract. I think it ranges from about 3,000 to 7,000 as the payment. And then they also have an RN in Rhode Island. So the same thing, you know, everything's pretty negotiable, which is some of the things I like. If you negotiate for a contract and the person in the facility might be interested in the candidate, but not like the rate you sent, you might get messages that will come back and say, rate too high. So that doesn't mean that they decline the candidate. That just means you have to decide how much you want to adjust your bill rate. And, you know, some of that I tell people, consider, is it a contract? If it's just a shift, we typically don't adjust the pay rates for shifts or bill rates for shifts, but for a contract, I would consider adjusting the bill rate, because that's just a longer term monetary situation. So we looked at the views, contract patterns. That's just really talking about how, when we look at it here, for those that have it, for the states that have it, what shift it is. So I know for a lot of people, it's important to know, well, am I working every weekend or every other weekend? So for some of the clients, they do tell you that particular shift. New Mexico does it a lot. So of course, this one's not a good one. But you just have to look like some of it, because they put this information in, so it kind of depends on how well they put the information in, whether or not you'll see. So like this one is Wednesday, Friday, Saturday from 5 a.m. to 5 p.m. So if we look at this one, just so you guys can understand it, it's showing the status is open. So that's ID or requisition number, start date. So we know 5/11 has gone, but that's just saying when they started, they desire to have the job open. But if they don't open it, they still have the need. So if the person starts 6/11, this would just be a 5-week contract starting from 6/11. For CNA, this is a facility and this is the first shift. So the first shift for this particular facility is 5 a.m. to 5 p.m. with a 30-minute meal break. They're guaranteeing 36 hours. So the person will get 36 hours paid over a 5-week period. And the work schedule anticipated, I always tell people to be flexible, is Wednesday, Friday, Saturday, 12 hours. So that kind of gives you an idea. So this is the client, and then you'll have your registrants under there as well. Here is where you'll actually see your time cards. So you'll get time cards for all of your employees that'll drop the week after they work here. Invoicing, I've never seen this particular field populate, but you receive an email. So you'll receive the same weekly email that you'll get for the time cards, you'll receive for invoicing. And then when you get your information and set up in the system, you can set up your users. Like if you wanted to add people, change information, do different things, you can do that here. And I encourage people to change their preferences and stuff, just because otherwise you'll get everything that's checked. You'll get facility cancellation, confirmation, field jobs. So for me, I unchecked all of these boxes because I don't need all of that. I go into the system enough, that I don't check here as much. But if you wanted to get like a report for facility cancellations, you can check that and just save it so that you're up to date on any canceled shifts. So it doesn't let you really go all the way down to a specific client. So it'll do it for all the facilities. So that's primarily why I don't check the boxes, because there's too many facilities, which would mean it would be too many emails. So I could just come in here and sort by cancellations if I needed to know. So I've been doing a lot of talking, so I want to give you guys a chance to ask some questions. We did record this. So I will share the recording. I will add everybody to a separate group chat. So there was another group chat for here, and share the recording there. Give me a couple of days. And if you are on Stafferlink or you have questions, I'll share this video and the presentation, and then a document that shows you what you need from an insurance standpoint of view. But you really want to reach out to the account managers. There's really not much I can do that'll facilitate the process. If you're missing specific insurance, like let me see if I have it. What the language around the insurance is specific. If you're missing it, they will not clear your insurance or your organization to go. So I tell people, make sure, okay, so I don't have it here. I'll share it. But I tell people to make sure that they have it in place, because that can be a hang up. So one of the things that is asked for in the insurance is that you specifically say each client that you want access to in the little box. It's bolded out in red, so it's super easy to follow. If you don't have each box completed, when you get your certificate of insurance from your insured, send it back and have them do it exactly how it is. So that's the main hang up. For us, it took maybe 3 or 4 days after we submitted it to I'll share an account manager when I send the group chat information. So before you reach out, make sure you have your information together. But I'll send the video, the presentation, and the insurance information. So if you don't have your insurance or your insurance is in the proper coverage, don't reach out to the account manager, because you're just going to be wasting your time and wasting their time. So you can ask them, of course, if they who their clients are, but that'll be included in the list. So it'll list out all of their clients. But just to save time, only reach out if you have information that they're requesting. So, okay. Latasha, did you have a question?
Yeah, so once you sit all your, because we submitted all our insurance information, and I guess it's been about 10 days now. So I was just wondering, did you know, once you get everything submitted correctly, what's the turnaround time?
So it shouldn't take that. Well, for us, it was 3 or 4 days. So I would maybe email and reach out again.
Okay.
Yeah, just email and kind of say, hey, can you give me a status? When I did our reach out, she said, when she did the initial email, she said 5 business days. So they hit around that 5 business day mark.
Okay. All right. All right. Thank you.
You're welcome. Anybody else? So this is you all's time to ask questions. I'm going to see.
Yes, I have a question.
Go ahead.
From your experience working with VMS versus having private contracts, have you seen more consistency and more profits with VMS or with private contracts?
For us, I would say VMS, we didn't have that many private contracts. We had maybe 3. And mostly for us, or I tell people, it's a bit of a hard to answer question, because we also had the VMS system that I showed you guys that we also used had enormous needs. So like, I think we looked now, it's 900. It was always 300 needs. So we never were able to fill all of their needs, but they kept us consistently busy. And we didn't have to do, which I've seen some nurses experience, that back and forth with clients about getting paid. So we focused on filling the jobs, bringing in the people, pushing them into contracts, and they wrote the check. It was kind of like a circle or an automated process impact that made a difference, especially since we were so small and we kind of didn't get bogged down into invoicing. We didn't invoice. The system automatically does all of that. You get copies of your invoice. If you need to get it corrected, there's a process, there's a specific, department, payroll department, invoice department that you can go, inquire with and get information from. And it's not to say we didn't have issues, because we did have a couple of employees that caused us to have some issues because they worked with other agencies that were also in the system, but they were very good about correcting it, sending us the correction, sending us the corrected invoice. So, for us, some of that, for me, it was worth having the VMS to not have to manage a lot of that, because
I guess it would depend on, your location, because Maryland, I know for sure we saw all those needs, but here in Texas, I'm not familiar with any VMS systems. You know what I mean? So I guess it just depends on the area you're operating in, whether or not you'll have a consistency and good money in that area.
Right. And I mean, there are vendor management systems everywhere. So we picked that one. That was a client we worked with before, and we just kind of stuck with it. But Health Trust is in Texas, because they run a lot of your HCA hospitals, Texas and Florida. They're a little bit harder to get into. Cross Country, A&M Healthcare. So there's a lot of systems that really cover different parts of the United States. the main benefit for us and some of the other people that might be in the system, career staff, is that it's one of the easiest systems to access. Some of your other systems like Health Trust or even Favorite will say they want you to have 2 years of experience or 2 years of business or have a 2 million, 4 million insurance coverage, which is of course more expensive than your traditional 1 and 3. So, this kind of helps as far as, hitting that first hurdle of getting your foot in the door. So, but I definitely agree. It's dependent upon the state. And some people expand into other states. So it's something to consider when you decide to expand as well. Any other questions? You guys don't have any questions for me?
Well, I guess I know I came in a little late. I guess with the career staff, when you were showing us, and Illinois didn't pop up, was that just for that particular Genesis Health system?
Right. So the Stafferlink that I showed has multiple clients. Genesis Healthcare is one of them. So of the clients that they had, Illinois wasn't one of them. Illinois used to be one of the clients for Kindred Healthcare. So Kindred Healthcare left Stafferlink or career staff as a client holder. So when I tell people check with your account manager, the clients come and go. So like career staff added a whole bunch of new clients. Some of them because they bought out Genesis properties. Some of them are just new. Like Fusion Healthcare is new. They also have Rite Aid as a client. Recover Care, Complete Care, those are all new clients. So they're always acquiring new clients. So that's where you want to kind of always be in contact with your account manager. And if a new client comes or leaves, they'll tell you. So when we first started, Kindred Healthcare, which kind of covers Illinois, Indiana, I think Ohio too, and Kentucky was a part of the system, but they left, I want to say probably 2 years ago. So Kindred Healthcare left career staff as their VMS. So they may have gone with another company or not.
Okay. All right. Thank you.
Mm-hmm.
So I guess I'm wondering, so that means that even when they do call me back, it's just chances are we may not see assignments there. Because right now we're primarily here, in this area, Indiana, Chicago. So
when you reply to the email to the account manager, ask if they have any clients out there. So
okay.
They'll be able to tell you. Because they recently
I think their corporate office is here in Illinois, right?
No, their corporate office is in PA, Pennsylvania.
Oh, okay. I don't know where I saw Schaumburg, Illinois at. Okay.
That's their payroll. They roll their payroll out of
okay.
Schaumburg.
Mm-hmm. Gotcha.
So anybody else?
Hey Shamika, this is Love.
Hi.
How are you? Which VMS did you say staffed Florida, Massachusetts, and Texas? I know I heard Mass, but I'm not sure for what VMS it was. And also I didn't hear much about Florida nor Texas.
Okay, so for Massachusetts, there's a lot of opportunities with career staff. You just need to add I'll send it to you, Love. I think Bear Mountain is their new client. Recover Care is another client, and Priority Healthcare. So those are all new clients that are out of Massachusetts. And then for Florida, they used to, and you can ask your account manager, there used to be Genesis properties in Florida. I'm not sure what happened because when I searched it, it didn't come up. So just ask your account manager. But as far as like Texas and Florida and some of Tennessee and other parts of the US, Health Trust has the HCA hospitals. So they're the VMS for the HCA hospitals.
Okay. And is it like difficult to join Health Trust? It is.
I haven't come into contract with more than just one NOSA that's been able to get through Health Trust. Now, it's not to say you can't, it's just to say that you really have to sell them. You have to have more than one client. I think Health Trust also requires a higher insurance premium, which I think is also part of the reason why some of the people haven't decided. I want to say it's a 2 million, 4 million premium that they're asking for, which is quite costly from a agency standpoint of view.
Okay, thank you.
You're welcome. Anyone else? I want to give you guys a chance to ask some questions. And like I mentioned, they do have trainings every other Thursday. I think there is one this Thursday. So Latasha, when you reach out to your account manager, maybe ask them if the training is this Thursday, and you can probably attend just to see.
Okay.
And if you get into Stafferlink, you also want to make sure that you get your access for B4 Health.
Okay.
Because, you know, they're different systems, but sometimes they push clients into different systems. So that, the other thing is a lot of, you know, there's a list in the group under files of different other ones, other vendor management systems in the process that some people have been able to get through. For the most part, the ones that I share, I do know somebody in each one. So I know somebody who's a ShiftWise. You know, the process looks different. What they're looking for and asking for sometimes could be different. They may want you to have more years in business. They may want you to be Joint Commission certified. So that might be some of it as to why the person versus another person was able to get in. You know, it's been a great revenue generator for us. As you guys saw, there's a lot of openings, but I really encourage people prior to, just because this is how we were able to figure out, prior to jumping in and actually starting the staffing process, create an in-house process. I tell people, go through the process of putting yourself in. And then from that, you're able to really see where there may be gaps in your process that'll slow it down for other applicants. So you can add yourself. I've added myself. My partner, he added himself when we first got started. And that really helped us understand how much time it takes to upload the documents, what exactly they're looking for, if they have like specific things. I will say now versus when we got started, they have an attestation form that you can complete. So that can bypass a lot of the time as far as the back and forth, where you're essentially attesting to that the background, drug screen, TB, Hep B, CPR is complete in their file, so that if you don't have it done today, you'll have it done prior to when the person starts. And that's helped out a lot of agency owners in moving them through the process more quickly. But you need to have that file complete, because in lieu of, you know, checking every box through the system, Career Staff has included in their contract that they will do audits. So if, for instance, they say, oh, Shamika, we want to audit your records, you would need to be able to provide those documents that you attest to are there prior to having your employee start. So that's a nice little hurdle versus they've limited the amount of forms. When we started, we had close to, I want to say 12 forms to complete. So now it's more like 8 or 10. And a lot of the stuff your applicants should have, if they're travelers, for sure they should have. Even if they're local agency, they should have this stuff. So it should never be an issue on the part of the applicant side to say they don't have it. If they don't have it, then they're probably not interested in the role. I know as a traveler, former traveler myself, I had a little pocket thing, folder where I can send my stuff to recruiter, or you can use a system like a Kamana, where it can house it and you can just kind of say when they apply, hey, upload these documents. So that's a great way to automate it, or any other type of system that you may have that'll help with the automation of the process, so that once you have something open, or once something is open, you can bid on it, put a minute and go. And I will say too, most of the facilities are really good, sometimes not always, but most of the facilities are really good about when they put jobs out there, they're real jobs. They want to get them filled so that once you put your person in, they're going to confirm it or give some sort of feedback. You're not just kind of waiting in limbo. Usually our stuff would turn around in at the most 2 days. So once we submitted a person for an application or for an opening, we would know if they picked them or they picked somebody else within a 2-day time frame. So, well, if you guys don't have any other questions for me, thanks for hanging out with me tonight. I hope you guys have a good rest of your week. As I mentioned, give me till Friday to get that information to you guys.